Hello, I'm Jason Howland, and welcome to Speaking of Health, the place to help you learn how to live a longer and healthier life. You know, earaches can be a common problem, especially for young children. But what causes earaches, and what's the best way to treat them and prevent them from occurring in the future? Joining us today is Dr. Majestic Tam. He is a ear, nose, and throat specialist from Mayo Clinic Health System. Dr. Tam, thanks for joining us.
Thank you, Jason. Thanks for having me.
Well, in order to understand earaches, why don't we begin with the makeup of the ear and how it exactly allows everyone to hear?
Sure. So, Jason, sound waves typically get conducted through the ear canal and then hit the eardrum, and the eardrum amplifies the sound through three little bones in the ear called the hammer, the anvil, and the stirrup, or the malleus, the incus, and the stapes, and then that amplifies sound through the cochlea as a sound wave through fluid into electrical signal into the brain. It's divided into the outer ear, which is the ear canal, the eardrum, the middle ear, which is the space which holds the bones, and then the inner ear, which is the cochlea and the nerve to the brain.
So how common are earaches, and what are some of the possible causes?
Sure. Earaches are very common. It makes up a majority of a lot of our practices. They can be caused by many different things. Some of the more common causes are, we can divide them into outer ear infections, or better known as swimmer's ear, middle ear infections, a lot of younger children get them, and inner ear infections.
So let's start with the outer ear infections, the swimmer's ear.
Sure.
What is that? Is that just for swimmers?
No, not at all, actually. I think it was given that name because it was common in swimmers, because as you get when you get fluid or moisture in the ear and it gets trapped there, it provides a very good medium or a place for bacteria to grow and cause an infection. Basically, you can get swimmer's ear just from moisture in the ear in the warm weather, or if you get water trapped in the ear, either from even just taking a bath or swimming, things like that. And things that compound the problem would be if you damage the ear canal, either by sticking something in there or through some trauma. You have a little cut, bacteria can get in there, and that's essentially swimmer's ear, and you can get swelling, pain, bleeding, infection in the outer ear.
And so how do you treat swimmer's ear?
The most common treatment would be ear drops, I would say. Typically, if the ear swells a lot, we can put in a little, what we call an ear wick, which would provide stenting the ear open from closing completely, because you can get a lot of swelling and it's a small space in there. Mm-hmm. And then sometimes if it's severe, we can put people on oral antibiotics as well.
So how about infections of the middle ear? When we think of ear infections, that's probably what we're familiar with, especially parents, right?
Correct. So middle ear infections are very common, especially in younger children, but we do see them in adults as well. It typically occurs after a cold or upper respiratory tract infection. It's more common in children because the eustachian tube, which is a tube that connects your ear, the middle ear, to the back of your nose, which can drain the fluid sometimes. In children, it's flatter and it's not as wide, so gravity can't pull the fluid out as easily, and it's narrower as well. Typically, again, as I said, it happens after a cold. Symptoms you can get are plugging sensation in the ear, fullness in the ear, pain, loss of hearing, sometimes even ringing in the ears. You might hear some crackling and popping in the ear.
And that's all caused just from fluid buildup?
Yes, it can be fluid. It can be, if it gets infected, if the fluid gets infected, it can be pus sometimes.
What can you do for treatments, especially for the young kids?
Typically, we give a lot, oral antibiotics are given. Sometimes that will treat the problem. If that does not treat the problem, or if it's a chronic problem, meaning there are multiple ear infections over a period of time, we do offer ear tubes, and that basically will cure the ear infections, the middle ear infections.
And what do you mean by ear tubes?
Ear tubes are a very simple surgical procedure. Basically, we make a small incision in the eardrum, and that will drain the fluid, and we put a small plastic tube in that incision, and that keeps the incision open so that when there is a buildup of fluid, the fluid can drain. And it also acts as it equalizes the pressure between the outer ear and the middle ear, so it prevents infection.
All right, Dr. Tam, how about babies that get earaches? I know we talked about small children and adults.
Sure.
What about babies that get a lot of earaches? Can there be a cause for that or ways to prevent that?
Yes. One of the big things is to not bottle feed your baby in the lying down position. That has been shown to kind of cause earaches, possibly because the milk or the formula is being pushed up into the ears through the eustachian tube, and that can cause infection in the ear. I know there's been a movement for quite some time now with breastfeeding, and breastfeeding actually has been shown to prevent earaches and ear infections in some children, possibly from passing on immune system antibodies from the mother to the baby. So if that is something that mothers would consider, that would definitely help as well.
And when you talked about surgery in the ear tubes, is there a certain age minimum requirement for that?
No, actually there isn't. It's a very safe procedure. It's very quick, and we do a lot of them. I would say that a lot of people worry that there's long-term damage from the ear tubes and the surgery, and I would say that there really isn't. Once the tube typically comes out on its own, and once it's out, the eardrum heals normally, and there's really no hearing loss or any long-term damage. Obviously, there are exceptions. If there are multiple sets of tubes needed over time, then you can get a little scarring. But in general, it's a very, very safe and easy procedure.
So they actually come out on their own?
Correct.
And how long of a time period are they in there?
I would say on average about a year. Sometimes a little sooner, sometimes they're in a little longer. They're very safe to be in the body, and they typically come on their own, and you don't even notice it.
What advice would you give parents with young children? They get an earache. Obviously, it's pretty common. Is maybe the first bit of advice is just to wait and see?
I would say that if there's suspicion that there's an ear infection, I would say definitely get it looked at by either us or their pediatrician. And if there's suspicion that there is an ear infection, I would definitely recommend possibly a course of oral antibiotics to see if it clears. And if it doesn't, then definitely have a conversation with one of us about ear tubes, possibly if it's becoming a chronic problem.
Dr. Tam, what about the eardrum? Can the eardrum get infected?
Absolutely, Jason. I think that the eardrum infection is called laryngitis. It is inflammation of the eardrum, exactly as we were saying, and it can be caused by a couple different things. Infection of the ear canal can actually move down onto the eardrum. It can also be caused by trauma to the eardrum, such as a hole or perforation of the eardrum. Common symptoms of this would be bleeding from the ear. You can have drainage such as pus or fluid from the ear, and also pain, hearing loss, sometimes ringing and dizziness as well. If you're having an ear infection and all of a sudden some of the pain goes away, that may be because the eardrum has ruptured and now you've drained some of the fluid.
And can that eardrum heal? it sounds pretty dangerous when you're talking about the eardrum rupturing.
Right. The eardrum is very resilient. Actually, it heals quite well on its own, given a little bit of time. And if the cause of the rupture or the cause of the infection is treated, it will heal on its own, typically. And we would probably give ear drops and possibly an oral antibiotic to treat that. Is
an inner ear infection the same thing as, or something similar as a ruptured eardrum?
No, those are two different things.
Okay.
A ruptured eardrum is typically caused by either trauma from an accident or something, or someone sticking like a Q-tip, or trauma from an outside object being placed in the eardrum. And that would be considered either an outer ear or middle ear issue, depending on if there's an infection involved. The inner ear is past the hearing bones and deeper than that, and typically you would not get an inner ear infection from a ruptured eardrum.
All right, so let's talk prevention. Okay. What's the best way to prevent earaches? Sometimes they're just going to happen, but what are some ways that folks can prevent earache?
A couple of environmental things I think to start with are very important. One is secondhand smoke or smoking. Is a very common cause of earaches, especially in children who are exposed to secondhand smoke. Hand hygiene, just general hygiene, and keeping your hands clean, not sticking your fingers in your ear, especially working around like dirt and farm and things like that. Keeping your ears dry is actually a very important thing. If you know you're going to be around moisture, water, use an earplug. Or if you know you got water in there, then you can use a hair dryer to dry it out. And those are kind of some of the main things that I would recommend.
What about ear candling? I've heard about ear candling. What exactly is that, and is it safe?
I would definitely not recommend ear candling. I think that there have been studies that have shown that ear candling is not effective and not safe.
And what is it? What is ear candling?
The ear candling, the thought behind ear candling is using candle wax to place the candle wax in the ear canal, and the thought is that the candle wax will suck out the wax when it dries up and it falls out, and that's the thought behind it. But I, again, highly would not recommend doing that.
Yeah, it sounds kind of a little bit dangerous when you're talking about hot stuff into the canal of your ear.
Exactly, exactly.
What about Q-tips, cotton swabs, those kind of things? A lot of people like to keep their ears clean, get the earwax out of their ears using Q-tips or other items.
Right.
What do you recommend when it comes to that?
As an ear, nose, and throat physician, I would not recommend Q-tips. I know that a majority of people do use them, and people use them in different ways and to different extents. I'd say that in general, we do not recommend using Q-tips because that Q-tips are probably the #1 cause of trauma to the ear canal, and also possibly even puncturing the eardrum. It's quite painful if that does happen, and not only that, you have very fine hairs and skin in the ear canal that when you're using the Q-tip you can damage that, and that can actually disrupt the mechanism the body uses to get rid of the earwax normally. And on top of that, if you break the skin with the Q-tips, you're more prone to getting infections in the ear.
So folks that do use that or do use ear candling, but they want to clean the wax out of their ears, what's the best way to do that?
2 things mainly I'd recommend. Well, 3. One is leave it alone. Typically, your body is geared towards moving the wax out on its own and getting rid of it. Your body is actually very good at it. The problem is when we try to help it, and it actually disrupts the mechanisms that our body uses. The second thing I would recommend is using any oil. Mineral oil is a good example. We can just use a small dropper, put some drops in there. Now, it won't come out right away, but what it does is it softens the earwax, and it makes it easier for the body to clear. You can also use some half peroxide, half water ear drops as well, or to flush the ears occasionally. Within the comfort level of the person doing it, I would say typically we do a lot of ear cleanings as well, so if there's any discomfort or if the comfort level is not there in cleaning the ears, we'd be happy to clean out the ears.
But for the most part, I guess what you're saying is the earwax is there for a reason. What reason is the earwax there?
Correct. It's absolutely correct. The earwax is actually a very protective thing that our body makes. It's actually called cerumen, and it's kind of like body oil in a way in our ears, and it hardens and it prevents bacterial growth. It changes the environment that bacteria don't like to grow in, and also it's a combination of some of the dead skin that your ear is trying to get rid of as well. So it's actually good that it prevents, it's a infection prevention mechanism as well.
So not only folks that are going in there and taking that earwax out, not only are they taking something out that is helping them, but they're also risking injury.
Correct. Yeah, absolutely. I would say that your earwax is there for a reason, and it's good. Obviously, there are cases where, when it can build up and it needs to be removed, if it's causing like hearing loss or problems, then, absolutely needs to be removed. But for the most part, earwax is healthy.
All right. Well, unfortunately, we're all out of time, but I'd like to thank our guest today, Dr. Majestic Tam, for joining us today on this great topic of earaches and ear infections. Thanks for joining us.
Thank you, Jason.
Have a great day, everyone, and be healthy.